Hi, I'm Heather Knight, Senior Education Manager.
And I'm Chloe Taylor-Jones, Education Manager.
And in this video we're just going to run through some of the subtle signs of stroke and the FAST test in a little bit more detail. I'm just going to go through the F for FAST test, and that's for face. And what you're looking for is any subtle signs of asymmetry. So you need to make sure you're on a level with the patient so you can see their face very, very clearly. And you can ask the patient to do some simple tests. Chloe, would you mind just raising your eyebrows for me? What you're looking for is whether there's any signs of unevenness in the natural furrows of the forehead, and also looking at the gap between the eyes, that's the palpebral fissure. Sometimes there could be very subtle narrowing on one side. Looking also at the nasolabial folds there by the side of the nose, and whether there's any flattening on one side. Chloe, would you mind smiling for me, please? That's great, thank you. And also looking at the smile, it's not always an obvious droop, it may be just slightly subtle. One side of the mouth doesn't raise up quite as much as the other. So we're just going to look at a list of the key points.
The A in FAST stands for arms. When looking at a patient's arms, we're assessing for pronator drift. In this section, I'm going to assess for pronator drift. I've asked Heather to demonstrate what a positive result would look like. Heather, please could you hold both your arms up, palms facing upwards, and close your eyes and hold them there for 11 seconds. Thank you. It's important that the patient closes their eyes to remove any visual stimuli, and this will allow us to identify even a subtle muscle weakness. In this case, what I'm looking for is a gradual downward drift or pronation of the arm. Here we can see both a downward drift and a partial pronation of the arm. Thank you, Heather, you can relax your arms. A patient presenting in this way is positive for pronator drift, and this is a sign of an abnormal underlying pathology and could be an indicator of stroke. There will now be a summary of this information on the screen.
I'm just going to cover the S in FAST, which is for speech. And sometimes it's assumed there's going to be really marked slowing of speech. What you're looking for is any changes in intonation and articulation, and sometimes this can be quite subtle. So you're listening out for whether there is a little bit of slurring or a sound of a slight pause, that there might be some kind of struggle in getting the words out and needing to think about speaking more than would be normal. Whether somebody's speaking a bit faster or they're stumbling over words. One of the things you can do is you can ask the patient to say a very simple phrase. So Chloe, would you mind saying red lorry, yellow lorry?
Red lorry, yellow lorry.
Thank you. When you give that instruction, it's really important that you give yourself a moment to pause, because you can stumble over it yourself. It's designed to catch out any sort of subtle signs. So let's just look at a list and some of the names of the type of disarticulation or dysarthria that can be encountered.
In the public awareness campaign on stroke, the T stands for time to call an ambulance. However, for the ambulance clinician, T can also stand for subtle signs of stroke. It's important to remember to ask about any recent onset of headache, visual disturbance or confusion, which could be transient, any difficulty in swallowing, or any new problems with balance. Any one of these symptoms can be a subtle sign of stroke and always warrants further investigation. There will now be a summary of these subtle signs of stroke on the screen. Thank you for watching. We hope this short video has been informative and will be useful for your future clinical practice.
We'll leave you with a list of bibliography and references and some links to some useful resources if you want to find out more.